Okay, so let's have a look at this one. This is just to illustrate what some lung findings look like for those of you that are, when you're doing reporting chest x-rays, sometimes people will just say consolidation, consolidation, consolidation without really thinking about what consolidation really is. And have said this on previous lectures, but I've found this really good example of what we're going to talk about now. So let's go from the top. Is this contrast enhanced study? Yeah, you can see there is a bit of contrast sitting within the aorta. You can see some contrast sitting within the pulmonary arteries, but none of these are particularly bright, are they? So the aorta is not bright, the pulmonary arteries are not bright. So this is not a CTPA. This is not an aortogram either. So therefore, what phase is this? It's actually a portovenous phase. You can see the portal vein is there, and that looks brighter. So the portal vein is here. Hang on, the portal vein is here. Portal vein is here, and the aorta is here, and this looks slightly brighter. So therefore, this must be a portovenous image. And what they've done is taken one go through in that particular phase, right? So let's scroll through, and we can see that, yeah, when you look at, that's the aorta, right? No, that's the pulmonary artery, that's the aorta there. But then you've got your SVC, and then you've got other things sitting here, and another thing sitting over here. Can you see that? And as you come up and down, they kind of come in and disappear again. And those are called lymph nodes. So you've got a few lymph nodes there. They're not massive, but they are bigger than they should really be. And coming further down, can't see any other lymph nodes anywhere. Can you? Maybe there's one there. But as you come further down, you can see that there is something a bit abnormal about this area over here. So what you actually do now is go to the lung windows, and you can see that it's got this linear sort of hypodense areas over there. Can you see that? And they look like straws sitting within a glass of water or a glass of gunk. And that's essentially what it is. It's a straw sitting within a cup, which is the lungs, and the straw stays patent with air within it. But the lungs are full of like this fluid, and that's what we know as consolidated changes. And so this is extensive consolidation and there's a few kind of areas where it looks a little bit sort of shadowy, a bit hazy, and that's known as ground glass change. So you've got a combination of ground glass change and this consolidated change is located in exactly right. Someone said the right lower lobe. And so that's a right lower lobe consolidation. So a few people have asked whether this is a PE. So this is not the best example for looking for a PE, because you know how I pointed out pretty much on purpose actually to try and illustrate like why this is not a CTPA and why this is not a CT aorta. And so it can be difficult. And I'm not saying you can't see whether there's a PE. It could be a PE, but I wouldn't bank on it. And I would normally say that there is no large pulmonary embolus if someone calls me up and says, look, is it PE or not? But one thing that I would say that goes against this being a PE-induced issue, because I think a PE, I guess, could cause consolidation because of ischemia, is the fact they've got so many enlarged lymph nodes, right? So you can get, you can get infarcts, but the fact this person's got a few enlarged lymph nodes, and on this particular phase of imaging, I can't see a PE anywhere. And if you do see one, do tell me where you think it is, and I can try and take a look. But based on the imaging that we've got in terms of lymph nodes and the consolidation, I would go for infection over anything else. And actually, there might be a small pleural effusion here, maybe very, very small, around the back there. Let's see, maybe not. But I mean, look, that's the thing. Like, so people are talking about PEs, right? So can infection cause a PE? It could. Can PE cause an infection? Not really, but you can get consolidation as a result of infarction. But when you've got sort of lymphadenopathy, yeah, so the person said, yeah, you're right, that one there, yeah, right, hyaline lymphadenopathy. When you've got lymphadenopathy, then you would actually go for this being infection. Now, someone said, they said, can you get a contrast enhanced study? So this is a contrast enhanced study. So what you actually probably mean is you want contrast, but in the CT pulmonary angiogram. So you want to be a pulmonary angiogram or a CT angiogram phase, right? And so this is not the right phase for that. Yeah, so you definitely want a PE protocol, and that's when this will be very, very bright if you want to be looking into this. But again, also you've got to think about the clinical picture. Did this person come in with infection, or did they come in with acute shortness of breath? I remember this patient. What ended up happening was this patient came with consolidation. I think they were treated. Then they came back and the consolidation didn't get much better. And then we did a CT chest under pelvis to look for a malignancy, and there was no malignancy from what we could see, and therefore we put it down to being infection. So yeah, this wasn't a P on this one.